At his annual checkup, Tim's doctor tells him important things he should know about his health. Tim gets his cholesterol checked with a simple blood test. Even though Tim doesn't have any symptoms, his doctor says his cholesterol level is high, which means fatty plaque can build up on the walls of his arteries. He needs to lower it to under 200. Otherwise, he has an increased risk of heart disease, heart attack, and stroke. Fortunately, eating better and exercising more may be enough to bring Tim's level down. The doctor checks Tim's body mass index, or BMI, a calculation that can indicate if you're at a healthy weight for your height. For very muscular people, BMI is not a good measure of healthy weight status, but for most people, the higher your BMI, the more body fat you have. That puts you at a greater risk for heart disease, type 2 diabetes, high cholesterol, high blood pressure, breathing problems, and some cancers. Tim's BMI is 30, higher than the healthy range of 18.5 to 24.9. Tim needs to lower his BMI. His doctor says a BMI of 30 or higher significantly increases his health risks. Tim has a hard time fitting exercise into his schedule, but his doctor tells him that physical activity combined with a healthy diet can help lower his BMI. Tim starts to think about ways he can increase his physical activity and improve his diet to help lower his BMI. Tim knows diabetes can cause a bunch of health problems, like nerve damage, kidney disease, vision loss, and even amputations, so he gets his blood sugar checked as part of his annual physical. A blood sugar check is important because it, along with high cholesterol, high BMI, high blood pressure, and physical inactivity, increases your risk for developing type 2 diabetes. After fasting, a simple blood test shows Tim's blood sugar level is healthy, less than 100. His doctor says between 100 and 125 is considered prediabetes, which, if left uncontrolled, may lead to diabetes. Blood sugar higher than 126 could mean a person has diabetes. Tim can keep a healthy blood sugar level by limiting fats, sugars, and processed foods in his diet and exercising regularly. Tim gets his blood pressure taken at his doctor visit, but he's not sure what it means. His doctor tells him blood pressure is the force pressing outward on the walls of his arteries. High blood pressure, called the silent killer, has no symptoms but can cause stroke, vision loss, kidney damage, heart attack, and erectile dysfunction in men. Tim's blood pressure is normal, less than 120/80. Higher than that puts people at risk for developing high blood pressure, and 140/90 or higher is considered high blood pressure. Keeping a healthy blood pressure level includes limiting salt in your diet, exercising regularly, maintaining a healthy weight, and discussing your blood pressure with your doctor. Tim smokes and knows he should quit for his family. His doctor reminds him that any kind of tobacco use is linked to cancer, heart attack, stroke, chronic obstructive pulmonary disease, asthma, high blood pressure, and nerve damage. MCHCP provides options to help people quit. Tim's glad he talked with his doctor. He feels confident that he can improve his overall health. He knows if he doesn't take control of his health, no one will. For more information, visit www.mchcp.org or call 800-487-0771.